Hello everyone, welcome in this channel. Today's topic is asphyxia. Today's topic is asphyxia. So what is asphyxia? Definition. Asphyxia is a condition produced by lack of oxygen to the tissues and other organs. When oxygen supply to body cells are inadequate or absent, totally absent, then asphyxia will occur. In asphyxia, hypoxia is there, that is low oxygen content, or anoxia, that is no oxygen, and accumulation of carbon dioxide, that is hypercapnia. Hypoxia or anoxia and hypercapnia, two features are there. This is due to disturbance of impairment of respiration leading to oxygen, lack of oxygen and excess retention of carbon dioxide. If a person is not able to breathe in for few minutes, then he will develop asphyxia leading to convulsion, coma or death. And when he survives, then there is certain damage to vital organs and other organs. This is asphyxia. Now, causes of asphyxia. Main cause is mechanical obstruction. Main cause is mechanical obstruction to of or to airways. For example, in case of suffocation, hanging, then choking, pressure on face, on nose and mouth, pressure on compression of neck and compression of chest. All these things are in mechanical obstruction of airways. Number two, other causes are: number one, contraction of airways. Contraction of airways due to you see in asthma, laryngospasm, as seen in allergic conditions or due to some fumes, allergic fumes, or due to some gases. This laryngospasm will occur. Then third is lack of oxygen. Lack of oxygen is seen in underwater, when underwater, in drowning or overcrowding in a very closed space. Then this will cause lack of oxygen, or in environment where oxygen is not present. Then fourth may be drug overdose and certain diseases of lung, for example, adult respiratory distress syndrome. These are some causes of asphyxia. Now coming to effect of asphyxia. Effects. Hypoxia can break the machinery. Lack of oxygen can break the machinery. All cells are sensitive to oxygen. Some cells are more sensitive. For example, brain cells, neurons are very sensitive to lack of oxygen. and brain will not work or brain death will occur if oxygen is not supplied to the brain for 5 minutes only. Maximum 5 minutes, 3 to 5 minutes and maximum 5 minutes. Brain, CNS, then heart. Heart is also affected very much. Heart, these two things, then kidneys and respiratory centers. All are affected, but CNS, brain death or heart will not work, kidney will not work, and respiratory system will not work, respiratory center will not work. This will, if a patient survives episode of asphyxia, then he may suffer from some form of morbidity. Now, stages of asphyxia. Stages of asphyxia. Number one, stage of no, number one stage of apnea. Apnea means cessation of respiration. No respiration is occurring there. Then this will cause lack of oxygen, and excess accumulation of carbon dioxide, retention of lack of oxygen and retention of carbon dioxide. That is, lack of oxygen is known as hypoxia or anoxia may occur. Anoxia means no oxygen. And retention of carbon dioxide is, this is, carbon dioxide will cause hypercapnia. These two things are very potent stimulant of respiratory center, and due to this hypercapnia and hypoxic effect, second stage will occur. Respiration will start, that is aggressive respiratory efforts. Aggressive respiratory efforts will occur. Aggressive respiratory efforts will occur. All respiratory muscles plus accessory muscles all will try to breathe. All will try to start breathing due to powerful stimulant of hypoxia and hypercapnia on respiratory centers and brain. This will try to start breathing. Number 3, this is first stage is for 1 minute, second is for 2 to 3 minutes, then third stage. Third stage is convulsion and confusion. All muscles of the body, all body muscles will act synergistically. There will be convulsion and relaxation to remove the effect of asphyxia. This will, and at this stage, sympathetic and parasympathetic nerves start releasing their hormones that will cause increase in blood pressure, that is hypertension, increased heart rate, tachycardia, palpitation, ectopic beats will palpitation, ectopic beats will start and respiration will become jerky, that is gasping, gasping respiration will occur, gasping respiration will occur, and fourth stage is a stage of collapse, a stage of collapse due to excessive muscular activities. Excessive muscular activities, all source of energies are exhausted. There is no source of energy is remaining. Heart is not working. Convulsion followed by coma and death. Collapse due to convulsions, exhausted, patient is exhausted. Number two, hormones from sympathetic, parasympathetic, neurotransmitters and certain hormones all are stimulating, all are trying to stimulate heart with bad effects, adverse effects. Therefore, this coma will occur and death will occur. Now treatment. What is treatment of asphyxia? Treatment of asphyxia is very difficult. And for example, if there is choking and you are able to remove the obstructive material within minutes, then patient will survive. Treat the cause. Treat the cause. And then artificial respiration. Then artificial respiration. If patient survive, then then treat and monitor for morbid effect of hypoxia or asphyxia. Number 4 is close watch. Close watch of the patient. It is also have psychological effects. Then coming to prognosis. Prognosis. Prognosis is bad. Prognosis is terrible. In spite of all effort, patient may not survive. This is about asphyxia. This is about asphyxia. Please like and share this video and subscribe the channel. Thank you very much for watching. Thank you.